crisis. We put real legislation on the floor to ensure these tax credits do not expire. And Republicans blocked it, not once, not twice, but 13 times throughout the year. 13 times they voted against our extensions of the ACA credits. 13 times. We tried over and over again. Then we tried 1 year. We tried 2 years. We tried 3 years. We tried everything. They kept saying no. And, of course, Republicans had every opportunity to negotiate, to join us, offer a serious plan to prevent premiums from rising after January 1st. Instead, today Republicans voted down the only plan that would have stopped the premium spikes, while having no plan of their own. Until a few days ago, they had no plan at all to put on the floor. They were so embarrassed they had no plan, they said they put a little bubble gum and Scotch tape together and put together a ridiculous, phony plan that simply helps the insurance companies. It was a list of right-wing wish list. More junk insurance, fewer protections, restrictions on women's health care. Their plan, their junk insurance plan, it's called a junk insurance plan, has been ridiculed over and over and over again. And it couldn't even pass the Republican Senate. Today, actually, our proposal got more votes than theirs. Our vote actually had a majority. Theirs did not. Or theirs, no, our vote had a majority and was bipartisan, and theirs was not. After today's vote, the American health care crisis is now 100% on Republican shoulders. On January 1st, premiums are going to go up. All of us have had people crying in front of us, in our arms, saying, what are they going to do when they've cut off the money that pays for my daughter's cancer treatment? What am I going to do? They've told me that my dad or mom is going to be kicked out of their nursing home, which is going to close. What am I going to do when I have to change doctors who I've worked with for years on curing a disease that my spouse has? Well, coverage got a lot harder to afford, and families are facing a lot of impossible, horrible choices. And Republicans owned every bit of it because of the way they voted today. Shameful. Shame on them. They all seem to, so many of them seem to be in a bubble. You know, we know Trump's in a bubble when he calls affordability a hoax. And he says he doesn't want to do anything to help people with health care. They're in a bubble too. The suffering of people is going to be enormous and heart-wrenching. How can Republicans look themselves in the mirror knowing they have to go back home and tell people over the holidays, I voted to send your premiums up, Republicans are going to say. They're going to say they voted, are they going to tell their constituents they voted to double their monthly premiums? Are they going to tell their constituents they voted to kick you off insurance? Are they going to tell their constituents, I voted to get you sick and go broke? Because that's what Republicans did by blocking a clean extension of the tax credits. When families open their health insurance bills in January and see the sky-high premiums staring back at them, they will know. The American people will know that Democrats fought to stop these hikes, but Republicans fought to guarantee that they happen. Republicans blocked the solution. They blocked the backup solution. They blocked any negotiations, no matter how hard we tried. And now the next chapter begins. Republicans will have to answer to the American people, explain to the country why they chose higher health care costs over real solutions. Republicans must answer for why people will lose coverage. Republicans must answer why families see premiums double and triple over the next year. Democrats' focus does not change. We fought like hell to stop these hikes, and we're going to continue to fight like hell to bring costs down for the American people on health care, on housing, on electric rates, on groceries. But Republicans are fighting like hell to send those costs right through the roof. They're fighting like hell to kick people off insurance. They're fighting like hell to cut taxes and give sweet giveaways to billionaires and the ultra-rich. January 1st is coming. Republicans are responsible for what happens next. This is their crisis now, and they're going to have to answer for it. Senator Klobuchar.
All right. Thank you very much, Senator Schumer. And this is it. 13 times, not their lucky number. 13 times they rejected this. 13 times with the American people. So when that farmer, soybean farmer in Minnesota, says to me he sees nothing but a perfect storm of ugly because of the tariffs, because of the input costs for his farm equipment, and because of his health care premiums, I'm going to tell them 13 times we tried to do this. You have already seen how the public feels about this, whether it is the Virginia and the New Jersey governor's races, whether it is the statewide Georgia races, including a recent legislative race there. They said enough. They want us to be working together to do something about their health care. And we have given them the opportunity so many times. The straight extension. And we would like to do a lot more, believe me. Reverse the cuts from the big, beautiful betrayal of the bill when it comes to Medicaid. Do something more on my legislation for negotiation of prescription drugs so we could do that faster. Public option, you name it. There's a lot of choices here. But right now, we have an immediate crisis. And as Senator Schumer points out, this is not a January thing. It's going to be set by then. This is not a February thing. This is a now thing. And they not only rejected this 3 years, despite 4 of them, including a very conservative Republican voting with us today, they also rejected a 2-year. They also rejected a very clear vote on a simple 1-year extension that basically would have been the same amount of money as they sent to Argentina. So I don't know how they explain to that soybean farmer in Minnesota that it was more important for them to send money to Argentina for one of the president's buddies than it is to help people with their health care. 75% of the people on these plans are in red states. They're in states that Donald Trump won. So I am not surprised that 4 of our colleagues voted with us. What I'm surprised by is that we didn't get that extra 9 that we needed, who behind closed doors, or as you've heard talk in the House, know that we have to do something about this right away. Senator Schumer and I have heard from so many people in our states and throughout the country. Here's one we just heard from yesterday, Virginia. Aaron and his wife, cancer survivor, are going to see their premiums double. That means they're going to have to make some hard choices. Do they pay the high premiums so Aaron's wife can continue her cancer screenings, or do they get some kind of junk plan so that maybe if there's a catastrophe it gets paid for, but the ongoing help is not there? Becky was in a wheelchair who's making progress, and they predict she's going to be out of that wheelchair if she can finish her treatment and physical therapy, but she doesn't think she can afford the premiums. Throughout the country, the people have spoken out. And one state where this is key, when you look at the states that use the most of these plans, it is Texas, it is Florida, and it is the state of Georgia. And just by coincidence, we have the great senator from the state of Georgia, Raphael Warnock, joining us today.
A happy coincidence.
Thank you so much, Senator Klobuchar and Leader Schumer. After today's vote, I really only have one question. Who do the Washington Republicans work for? Who are they working for? First, you kick 15 million Americans off of their health care in order to give billionaires a tax cut. And then after doing that, you double the premiums on some 22 million additional Americans. For some people, you triple the premiums, quadruple the premiums. Who are you working for? These are people who are disproportionately in red districts. And we have tried time and time again, as my colleagues have said, to get the Republicans to make a different choice, and here we are today. 15 million Americans have lost their health care. 22 million Americans on average will see their premiums double. Just last night, I had to stand up and object to a UC that would have knocked an additional 1 million people off of health care. And my colleague who was putting forth that proposal, like me, he lives in a state that has not expanded Medicaid. And so here we are. The Republicans have demonstrated who they are working for. Certainly they're not working for you. They are not working for the people of Evans County, Georgia. I was there a couple of months ago. This is a county that voted overwhelmingly for Donald Trump. I won Georgia. I did not win that county, but I was there because I represent those people. They've already lost their labor and delivery unit, and they may well lose their ICU with these draconian cuts to health care. And so we've got to find a better way forward. We know that the status quo certainly has its problems. There's nobody who's saying that health care in America is terrific. But Republicans today have taken a system that's already struggling and broken it down even more. And the consequences for ordinary people, many of them in their own red districts, will be that they will have to delay response to their health care. They will have to find a way to pay more, higher premiums. And for many people, they will literally pay with their lives. And so we're not about to give up. We're going to keep fighting for those people. I've gotten arrested not once but twice fighting for health care. Dr. King said of all the injustices, inequality in health care is the most shocking and the most inhumane. And we're going to keep working at this until we center the people and get them their health care and their human dignity back.
Okay, questions on this subject? Yes.